So November is Diabetes Awareness Month, and it is important to us because about a little less than 2.5 years ago, our daughter was diagnosed with type 1 diabetes at 9 months old. I wanted to do this and to raise awareness so that other families are able to know the warning signs. Diabetes is something that shouldn't be taken lightly. It is life-threatening, and things with diabetes and when diagnosis happens, it can happen very quickly and things can change very quickly. Nora went from being and acting totally normal one day, and then within 48 hours she was very close to being in a diabetic coma. So it all happens very fast, and the symptoms can often be mistaken for your typical flu or another virus. Things like excessive thirst, frequent urination, if you've noticed weight loss. Nora was 9 months old at the time. She was exclusively breastfed, and we were cloth diapering her as well. So looking back, I guess maybe I could see some of the signs and symptoms, but in someone that young, it was very hard to see. Both of my kids were frequent nursers anyways, so that didn't seem odd to me. And when she was leaking through her diapers, I honestly thought that I was washing them wrong. And with cloth diapers, if you wash them or have problems with your wash routine, then you can get leaks. So I was in the process of correcting our wash routine for the cloth diapers when she was diagnosed as well. So that really didn't cross my mind. And really the symptoms that made us stop and say this is something that needs emergency medical attention was when she was in DKA, which is diabetic ketoacidosis, which is something that you do not want to experience with a diabetic. And she had gotten to the point where her breathing was strained. It was shallow breaths, shallow but deep breaths, like they were quick, but it was like she was using her whole body to breathe. And it wasn't until she started doing that I noticed that she just seemed so frail. I could almost see her skeletal system through her sleeper. It was crazy how in such a short period of time she went from looking like she was feeling under the weather, like she's breathing through her mouth, like maybe she was teething or had a stuffy nose or something like that. But then in the course of like 12 hours, it went from, well, we'll take her to the doctor tomorrow to we have to go now. We can't even drive to the doctor. And that's when I called 911, because I was literally afraid to put her in her car seat, because I thought that she would stop breathing on the way there. That labored breathing, which we know now is called Kussmaul breathing, it had no effect on her ability to get air. That is the body's last resort in DKA to try and get rid of the toxins that have built up. And when you're in DKA, your blood sugar is high and all of your body's levels are off. I actually had her hooked up to this little machine where it was like a constant kind of flow, because it was really hard because she was so dehydrated. Even though you're urinating a lot, you think, oh well, I must be hydrated because I keep producing waste, but really that you're still trying to flush out the sugar and the ketones that are spilling over. And so your body is really super dehydrated, and so it was really hard for them to get any sort of line in her to take blood. They actually, for IVs and things like that, they had to put one in her head for starters, and then once they were finally able to get one in her arm, they had to keep it open and keep flushing it out so that each hour they could cycle the blood through this little machine to get her sodium levels, electrolyte levels, things like that. My goal in raising awareness is so that no other parent has to go through that scary diagnosis story. And I know that we have a long way to go in awareness for that, because of all of the parents that I've spoken with, the diagnosis stories are the same. Everybody thinks that it's the flu or that it's a virus and it'll pass, and sometimes even doctors will say that and send kids home. So that's why I always tell people, if you're in doubt, ask for a blood sugar check. It's a finger prick, and you could at least get an idea of where blood sugar is and go from there. Or you could do a urine test to see where things are at. Also, it's a very easy test to administer. But it was scary, and she was in the PICU for 4 or 5 days before she was transferred to a regular floor. We were blessed that we were able to get her on a pump right away. Her doses of insulin were so small at the beginning. We were giving her 25 thousandths of 1 unit. 1 unit, if you see 1 unit on a quarter, it's like the tip of an eraser. That's the size of 1 unit of insulin. So we were giving her 25 thousandths of 1 unit per hour, which would be very difficult to measure out. So the fact that we were able to get a loaner pump right away in the hospital before insurance approved her own pump was amazing. And to have doctors that were so on board with the new technology that was available for her age. So I guess in today's post, I just want, if you take away anything, I just want you to take away that if you're seeing signs of frequent thirst and frequent trips to the bathroom, those are the telltale signs. If it gets to the point where there's this deep, rapid breathing, you just go straight to the ER, because that is danger territory right there. Drowsiness is associated with that. So another thing with the virus, it looks like what a flu would look like. If there's vomiting too on top of the frequent urination, that is a huge red flag to go straight to the ER too, because the high blood sugars will cause a tummy to be upset and vomiting to occur. And Nora didn't really, I didn't even really classify what she was doing as vomiting, because to me it was more like just spit up, but it kind of confused me a little bit, because neither of my kids ever were really spit uppy babies as far as after eating and things like that. So that was one of those weird things that I thought, well, this is weird. Well, maybe she's getting a little sick. But type 1 diabetes would have never crossed my mind, because we have no family history of it. It is an autoimmune disease. Autoimmune diseases run in our family, but type 1 diabetes is not one of those that have ever really popped up. And a lot of times there is a gene component to it. But it could happen to anybody. It doesn't matter what age they are. A lot of people are being diagnosed with type 1 diabetes in their 20s, 30s, and 40s, and 50s, and 60s even now. It's not just a kid thing either. A lot of times, the older you are, the slower the onset might be, and the younger you are, the quicker the onset happens, which is why I think that Nora went from looking and feeling good from what we could tell one day to completely she didn't even have energy to move at all. She was just listless, and she was just kind of like a baby doll right before we took her in. So share this with your friends and your family, and if you notice the signs, please don't be afraid to insist on getting a test done, because in my eyes it's better to be safe than sorry, and it's something that can change your life so fast. that if you even have an inkling, it's worth it to get it tested.